Hello and welcome. I'm Debbie Debickus. Welcome to my consultation today. And the consultation is on the topic of anxiety or anxious feelings. And I'm going to just give a disclaimer just now that I am not a doctor. I don't claim to be. I'm not a psychiatrist. So if clients come to me with a medical condition as anxiety and they're being treated by a medical professional for anxiety, I will contact them, or the client, their patient, will bring a referral to me saying that their doctor has no objection to hypnotherapy services working on their anxiety. Now that's just treating anxiety or working with anxiety if they have been diagnosed with it as a medical condition. But many of my clients will come to me with anxious symptoms, and there is a difference. I'll give you an example on both counts. I work closely with a wonderful psychiatrist, a Dr. Eric Weinstock, a wonderful, wonderful professional and a very, very real person. We just connect together. I'm sure you can feel that vibe. I would say that I have worked with some 200 minimum of his patients that have suffered from anxiety. And he will send me an email saying I have no objection to Debbie Debickus using hypnotherapy on Joe Blogs for his anxiety. When the client comes to see me, I don't look on him as a patient. I'll say, Joe Blog, sit down. Now, how is your anxiety affecting your life? And they may say I'm having panic attacks. I don't go out, I get so anxious, I've got heaviness on my chest. My mind goes racing, I can't stop those thoughts. I say, okay, so that's symptoms, that's behaviours in a certain way, but how is it affecting you? And Joe Blogs may say, I'm just scared to do anything. I want to go for promotion and I just get anxiety, or I do a presentation and I feel sick and anxious, or I can't sleep at night. I wake up and my thoughts are going, so I have anxiety, I can't even get to sleep. I'll then say, okay, let's look at the behaviours and what emotion is triggering those behaviours. And I tell you, in virtually every client that suffers anxiety or anxious feelings, there is a fear. There's a fear to feel anything. And that fear to feel anything can be a heavy feeling. It can be pushing them down, their chest, their kind of weight of the world on their shoulders. But that part that's scared to feel is scared to feel hurt. Is scared to feel sadness, is scared to feel pain. So it gets so anxious when they can feel any feelings coming up, and it shoves them down. And that's what medication does. It'll numb those feelings. And I'm all about, okay, if you're pushing down your feelings, you're also pushing down your joy, your happiness, your confidence and love. Because the opposite to me of fear is love. Living, joy. And fear and love and living in joy can't take the same space, the same place. And that anxious feeling will come up. And they may in fact have went to a doctor, psychiatrist and been given medication. And what I've learned is hypnotherapy is a very good complement. It works hand in hand with clients that are suffering from anxiety. So I'm not one to say medication doesn't work. I don't say that. I don't represent that. But sometimes it's not enough to get them to where they want to be. And that is content and confident and calm. If you can relate to anything that I'm saying, please get in touch with me. It may be that I do need a medical referral, which can be emailed to me, and that's not been an issue for me in the last 10 years. Or again, it might just be some anxious feelings you're feeling because you're getting married. Anxious feelings because you graduated. Anxious feelings because you've got a test to go for, your bar exam or your nursing exam. Or it could just be anxious because people have left home, your kids have left home, and it's now all about you. You might get some anxious feelings about going on a date. Perhaps you have been on a date for a long time. Perhaps you're widowed and you're starting over. Anxious thoughts and anxious feelings are normal or natural. There's nothing wrong with you. But some people just need a little help. Maybe they're going in for an operation or surgery or to the dentist, and they get all these anxiousness feelings, lack of focus. Again, a hypnotic programming session is super for that. It rewires you, reprograms the way you think about things. So please, if I can be of help to you at all, get in touch with me through my website, or you can email me at debbie.dubikis.com. Thank you.